While Harvard Medical School students are demanding federal funding to study nationwide gun violence as a public health issue. It's as though the previous segment was written especially for them. The group's organizer, Maki Srinivasan, said, quote, "As scientists, we're systematically prevented from studying the psychological and physiological phenomena involved in gun-related violence," adding, quote, "The result is that 22 years later, more than 600,000 gunshot victims later, much of the federal government has largely abandoned efforts to learn why people shoot one another for themselves and what can be done to prevent it," end quote. I'd be curious as to what these students, many of them first-year medical students, would like to study. Mental health, cultural effects, failures in existing gun control laws, gaps in communication between law enforcement agencies. I'm also curious as to why the as many as 400,000 malpractice deaths per year don't earn protests and demands from this same group, a group that will one day be in the best position possible to decrease that frightening number. See, these are the very people that will feel that they're gonna completely fill up the medical field. They're going to be leading the cause there. Shouldn't they be researching why so many of their colleagues are ending up with dead patients so they can figure out how they can avoid the exact same thing? It might be too obvious. And seems it's easier to embrace the anti-gun advocates' agenda. Amnesty International's propaganda, the British-based organization, and get a virtue signaling photo spread in anti-gun progressive magazines to prove just how aware they are. I don't think that that's going to help, but that seems to be the only thing that those sorts of individuals are doing.